Hi everyone, good afternoon. Thanks for hanging around for the afternoon talks. Hopefully my topic of conversation is not as controversial as Marissa's and you have easier questions for me. As Chris mentioned, I'm an intern at Moore this year, and just so that everyone knows what an intern is really, basically we're brand new veterinarians, we're baby vets. We just graduated last year in 2016. And we're basically doing a year of study/practice where we learn from more experienced veterinarians, kind of on-the-job training, things like that. So just so everyone has an idea of what an intern actually is, because I don't think it's really defined. And people come to the clinic and kind of wonder if we're students or wonder if we're doctors. We're still kind of a little bit of both, but hopefully now that we're 7 months in, we're trending a little more towards the doctor side. So let's talk about choke. So how many of you have had a horse choke on farm? Okay, so like almost half, not quite. That was probably a pretty scary thing, right? Yes, no, question mark. That's a totally valid thing to feel if you see your horse having a hard time or making a face like this. And I think a lot of that panic stems from the understanding of what choke is in people. Which is an obstruction of the windpipe or the trachea. And obviously that's a really bad thing because it can lead to almost immediate asphyxiation and death. However, it's a little bit different in horses, and it stems mostly from the anatomy differences. So it's the same anatomy, almost, but a different location of obstruction. So the trachea, or the windpipe, is the tube depicted in pink here, which transfers air from the nose to the lungs, and is how we and horses breathe. The esophagus, or the food pipe, I guess, is the structure in green, which moves food from the mouth to the stomach. Choke in horses occurs because of an obstruction in the esophagus, which is completely different to an obstruction in the trachea in people causing choke. And what this means is that even though you have an obstruction in your throat somewhere, the horse is not at an immediate risk of dying in the next 10 minutes, like a person might be if they have something stuck in their windpipe. This is not to say that choke in a horse is not an emergency. It absolutely is considered one, although hopefully this will bring you a little bit of peace of mind knowing that your horse is not going to die in the next 10 minutes if you don't relieve this obstruction. That's pretty much my main point here. In that, not to panic too quickly. You do need to call the vet because there are some serious complications that can result from this ailment. But to stay as calm as you possibly can. Next is why it tends to happen, and it can happen for a number of different reasons. As I already mentioned, the most common one is that they get a food bolus stuck in their esophagus, and they can't push it down. A lot of horses seem to be affected by feed that's really dry and coarse. For example, if you change the bedding to straw and your horse runs out of hay and decides to start munching on the straw, they don't really chew it as well as they would regular hay. Improperly soaking feeds that expand quickly, like sugar beet pulp, results in pellets swelling rapidly. Once the horse starts chewing it, it gets in their saliva, and they can't push it down their throat as well as if it had been previously soaked. Sorry. And horses that have accidentally swallowed foreign objects like potatoes or big pieces of carrots can choke as a result of that as well. Sometimes this has to do with the personality of your horse. Some horses that are super greedy eaters are kind of prone to choking because they don't chew their food very well. Their goal is to eat and eat quickly, and they don't really stop to think about, maybe I should chew this a little bit more before I swallow it. Other treats, kind of like those big stud muffins or anything like that for greedy horses can sometimes be a problem. Horses that are bullied even have a little bit of trouble with this because they tend to eat very quickly as well. Just because of the risk of competition from the other horses. They have a fear of being driven away from the feed pile, so they want to get as much into themselves as they possibly can when they can. The last one that horses are kind of at risk for include horses that don't have a great set of teeth on them. So this can range anywhere from young horses with kind of an innately bad mouth with bad teeth to older senior horses that kind of can't masticate their food properly and have trouble mashing their food enough to be swallowable, I suppose. We also see a couple of conditions that interfere with the horse's ability to swallow in the first place, such as sedation or previous injury to the neck or throat for any kind of trauma that might have happened there. And there's also some motility gastrointestinal issues, such as botulism, and these can all predispose a horse to choking. So yeah, as you can see, there's a number of different reasons that horses may choke, but in combination they can kind of brew the perfect storm, if you will, if your horse is exposed to any combination of these things. So what's the big deal, I guess, if your horse is choking and it's not at any immediate risk of death like they are in people, because their windpipe is still patent, they can still breathe. The first and foremost aspect to why choke is such a big deal is the nature of the animal in the first place. As Bailey mentioned, horses that are panicked will not always make the best decisions or life choices, and this tends to really freak them out. If they're not able to swallow, they think something is horribly wrong with themselves, and they can't possibly get over this, so the best way to correct this is to panic. And unfortunately, that doesn't help them at all, because it puts them at risk of further injuring themselves, it puts you at risk for being injured by them, and they could even make their choke worse. So that's why you want to call the vet if this is happening to you, because if they make it worse, then they place themselves at higher risk for complications of the choke, which I'll talk about a little bit about more later in my presentation. So what do you want to look for in your horse if it's choking? I'd like to start off by saying that obviously not all horses are the same. Depending on what your horse's nature is before this happens to them, they might exhibit signs differently. So some horses may just become very quiet or dull or reserved or anxious and just kind of stand off by themselves. Others may exhibit full-fledged colic signs, which can be very scary. Other things you might see if the choke is bad enough is horses kind of retching or coughing frequently, stretching their neck out like you see in the top two pictures. You may also see feed or coming out the horse's nose, which is a pretty good indicator of what's going on. They might also excessively salivate or swallow a lot. And this is a video that was supplied by one of our lovely technicians from this summer. This is a video of her horse having a choke episode. And you can see he's kind of just a little bit dull. He's not really running around acting panicked, but you can see him chewing a lot. You can kind of, even though it's from the right side, you can see the food bolus in his neck a little bit. And you can see him a little like retch, bring his head back and kind of cough, lick his lips, kind of just overall being anxious. And I'd also like to point out, as it's probably already obvious, but choking will happen while the horses are eating. It's not usually something that'll just happen spontaneously to your horse who's standing in his stall, kind of quietly, not really doing anything. This is going to happen when your horse is eating, as opposed to colic. So one of the big things that we'll get at the clinic is owners describing that they have a colicky horse, and then we get out to the farm and we find out that the horse is not actually colicky, but choking. But we don't really want you to feel bad if you misidentified your horse's choke as colic, because obviously these are two very serious conditions that both need veterinary attention. But just to kind of go over the primary signs of colic that you might see with your choking horse, but will definitely see with a colic. Your horse might paw at the ground, roll on its side, kick at its belly, flank watch or lie down. Choking horses are not usually likely to look at their belly, and not all colics will do this, but it's kind of just a good way to differentiate. Maybe if you see it, okay, yeah, my horse has a belly ache and his throat is okay. So now that you've recognized that your horse is choking, here are some things that you can do while you wait for the vet to arrive. First and foremost, stay calm. I mean, it's hard enough for a vet to come out and deal with a panicky horse and a panicky owner, so please remain as calm as possible. So also, if you stay calm, you're more likely to have a level head and know what to do in a scary situation. So, yeah, that's the first step. 80% of chokes kind of resolve on their own if the owner is able to remain calm and keep their horse calm as well. I know all of you have experienced being anxious in your horses. If you're anxious, they will be too. So if they know that you're calm, they'll have an easier time with it. The next most important steps that you can take are to put your horse in a clean, dry stall and take away all of its food and its water. If not allowing them to eat is going to help them be able to pass this food bolus. I know some people have tried, are of the thought that if you give them some food, the food itself will push the obstruction down the throat and into the stomach. Excuse me, that's not true, unfortunately. The best thing that you can do for them is to take their food and water away while you wait for the vet to come out. And if they're kind of really anxious, sometimes horses will eat shavings of their stall. This is a time that a basket muzzle or a grazing muzzle can come in handy to kind of keep their noses out of the dirt and keep them from swallowing anything. And these are a couple of things that I would beg you to please not do. This picture of a man with a garden hose. Has anyone ever heard that sticking a hose up your horse's nose or mouth is a good idea? Okay, good. I don't see any hands, so I'm assuming that you're all more intelligent than some of the stories of people I've heard. This is a terrible idea. Please never do this. I have heard from senior clinicians that they've had experienced this with some horses in some cases that they've seen, being the thought that if you just spray water down their throat, it'll help the obstruction pass. Please do not do this. It puts the horse at an extreme risk for a complication called aspiration pneumonia, which can actually be deadly if it happens. And I'll go into a little bit more detail about it at the end, but just so you know, this is why we don't stick hoses up our horses' noses. Second thing to please not do is walk your horse. As I mentioned before, one of the most important things you can do for your horse that's choking is to keep them calm. Walking them around and kind of stimulating like that is kind of doing the opposite. So another kind of important thing to think about is knowing the difference between colic and choke can be helpful in situations like this because obviously with a colicky horse you want to walk them. So if you know the difference between the two, you're better able to manage your horse on the farm while you wait for the vet to come out. Last thing, I kind of already mentioned this in the last slide, is don't give them anything to eat. Although it may be tempting, for the reasons I already went over with you guys, it's not the right thing to do, unfortunately. So now that you've done your part in helping your choking horse, these are the kind of steps that the vet will take once we get there and assess your horse. The first thing that we're going to do is a thorough physical exam, paying close attention to the lungs and the trachea of the horse. This will help us ascertain if the horse has aspirated any food material from their choking episode. And basically what we listen for are kind of like rattles or wheezes within the lungs, things like that, and that'll help us to determine a course of treatment plan. Next thing to do is likely sedate the horse with xylazine or Rompin, maybe some Torbidesic as well, and this will help, again, with the horse remaining calm, and what might actually help the horse pass it on its own, and we might not have to do anything other than this after we sedate them, which would be great because it'll lower your vet bill and your horse is more likely to be fine. We also might give them some Buscopan, and I know Dr. Malik talked about this drug in his presentation a little bit. It's an antispasmodic, and it'll help kind of relieve the esophagus of any spasm it might be in, because once there's a food bolus in there, it'll cause the esophagus to spasm to try and relieve it, and then it will likely cause the obstruction to get worse instead of better, unfortunately. Last thing to do is, in this picture at the bottom there, they're passing a nasogastric tube. And another similarity to a colic situation is what they're doing. Although it's for a different purpose with a colic, we're trying to get into the stomach to relieve either fluid or gas from the stomach. Here, it's simply a mechanical way to push the food bolus through the esophagus down into the stomach and manually relieve the obstruction. We might also give the horse some Banamine, which is to serve as an anti-inflammatory and relieve any pain that might be associated with the condition, and hopefully decrease the chances of complication of the esophagus after the choke is relieved. So as far as aftercare goes, the vet may or may not prescribe your horse some antibiotics. This is with the notion in mind that any food material or saliva or any foreign material may have made its way into your horse's lungs because of all the coughing and swallowing and things that have been going on since your horse began to choke. Excuse me. This is highly dependent on the situation and the veterinarian, so your horse may need antibiotics, it may not. It's highly situational dependent. Again, continuing with the Banamine, the vet is likely to give an IV injection and then give you a tube similar to the dewormer paste, the rollback dial, and you squirt it in their mouth orally for a couple of days. Definitely temperature taking for the next 3 or 4 days is important because if your horse has developed any kind of airway infection, this will probably be one of the first presentations to let you notice it. So if you're able to notice it right away and not wait until respiratory signs develop, then you're more able to contact your vet again and let them know what's going on to kind of get on top of any kind of infection that might take hold in the lungs kind of before it starts to get too bad. As far as refeeding goes, slurry feeding is a great way to reintroduce your horse to feed. It's a little bit easier for them to chew and to swallow. It's high in moisture content, so it's non-irritating. And keeping them on stall rest for a couple of days too is not a bad idea, especially when we take into consideration why the horse choked in the first place. Maybe you have some herd dynamic things going on outside that need to be addressed before they go back out there, like what we talked about before with the bullied horses or the greedy horses or things like that. So I mentioned this a couple times now. The complications that can arise from choke are very serious. I've kind of listed them here in most common to least common. The first being aspiration pneumonia, followed by esophageal stricture and esophageal rupture. So I'll just go through each of those briefly. So aspiration pneumonia, first, on the right, or I guess for you guys, the left, you see a pair of normal, healthy horse lungs. They're lovely and pink and blown up and happy. And then on the right, are a set of diseased lungs that are a result of aspiration pneumonia. And what aspiration pneumonia is basically your horse has inhaled some kind of foreign material, likely feed, that's introduced bacteria into a sterile environment. And a bacterial infection has been able to kind of take hold and take over the horse's lungs, and now the horse's lungs don't function anymore. They can't expand, they can't deliver oxygen, they're just kind of dying. And a lot of times, if this becomes so severe, it may require hospitalization. It can develop into a pleuropneumonia, which is essentially an infection of the lungs and the thoracic cavity. They'll require IV antibiotics, fluid therapy, and many other things that ultimately have a poor prognosis. There are milder cases of this as well, which don't become so serious, but those ones are often caught early and treated appropriately. So this is the biggest one that you want to worry about with your horse that's had a choke episode. The next one is esophageal stricture. Basically, this is an esophageal narrowing that is due to scar tissue, which forms after the esophagus has been traumatized due to the obstruction. The problem with this complication is that it requires special intervention and is a very difficult and risky procedure that could rupture the horse's esophagus. And even if the treatment is able to be performed, the outcome is not always 100% successful, in that the esophagus cannot return to its full function and diameter, and over time most scar tissue will form, resulting in the procedure needing to be repeated regularly, which, as you can imagine, is very costly. Also throughout this whole process, the narrowed section within the esophagus acts as an obstruction itself and can lead to recurring episodes of choke. So again, very bad. This is the last one, esophageal rupture. Although it's a rare complication, if the obstruction is large enough or is allowed to sit in the esophagus for a long period of time, it can actually cause the esophagus to rupture. If this happens, euthanasia is almost always recommended, as emergency surgical repair is challenging and successful treatment is hindered by secondary infection that establishes due to the leakage of feed material around the ruptured site. So now that we're done with the doom and gloom, we all know the old saying, prevention is better than cure. And this applies to choke as well. The best way to try and prevent choke really comes down to management, in terms of ensuring feed is easy to swallow and slowing horses down that are fast eaters. Also, properly soaking feed. For example, if you feed beet pulp, make sure that it's properly soaked. Usually we recommend 1 part beet pulp to 4 parts water, soaked for at least 8 hours. It's pretty common for vets to get called out to a choke when the owner is away and has left a neighbor or friend in charge of their horse. So make sure that there are written instructions in the barn as to how to properly prepare the beet pulp, and so that everyone knows what it is and no one thinks that it's kind of like a treat or anything like that. If you find that a horse is choking regularly on a particular feedstuff, change it. If your horse struggles with dry, coarse hay, you can try wetting it down with water for several hours prior to feeding. And if your horse is a horse that is a particularly fast eater, you could try a hay net or one of those nibble nets and adding large rocks to their feed tub so that they can't gobble up their grain quite as quickly. If your horses are fed in a group, you can separate feed along the fence line to reduce greediness and the fear of competition. Also, just as important as paying attention to the feed material, is ensuring there is a permanent clean supply of water. If you're having to sedate your horse at the barn, for instance, if you need to give your horse some Dorm gel to clip it, make sure you take their feed away for at least 45 minutes after you've given the sedation. Lastly, keep on top of your horse's teeth, especially older horses where age-related changes can make it very difficult to chew and swallow properly. In those cases, along with regular dental checks, a change in feed, for example, to hay cubes may be necessary. So, I think, I put that picture in because I thought it looked like Dr. Greg Evans, if anyone sees the resemblance. And that's it. I'd be happy to take your questions. Yeah. That's a great question. We often don't do this procedure just because very few people will elect to go for it. I know they use stents in dogs and small animals. Maybe one of the surgeons that's here can elaborate on that question, since I've never had any experience with it. Ollie.
She went out, but Dr. Sally is here, I think.
I think she left.
Just kidding.
Okay, well, I'm sorry, I don't really have a better answer for you. I'm sure it's possible. I don't see why you couldn't try, but again, I know that horse esophaguses are not of the same kind of what's the word I'm looking for? Same. They're not the same as dog GI systems. They don't have as much kind of rigor as carnivores or omnivores. So I'm not sure if that procedure would work well in a horse. But if you leave your email, I can actually look it up for you and send you a better answer.